McGarrion and their leadership team, and I walked away cautiously optimistic. We listened to the logic behind the and the future health of families here in the city of Elyria and surrounding communities. Point blank, period. And I'm proud to be joined by my colleague and Lorain and other mayors who are supporting this, realizing how important it is to their communities as well. We understand the demographic shifts that are happening, the economic shifts, and we empathize with companies that have to make tough business decisions. However, when we are considering the health of residents, in particular in life and death situations, that is what must come first. So we discussed what this decision would mean for Elyria and surrounding communities and the barriers and dangers it poses. And we asked what their plan is to overcome these challenges. Challenges that include the continuity of care and the relationship between doctors throughout the journey for families, transportation and the lack of transportation, of public transportation here in Lorain County, and how will emergency situations be handled not having the birthing center in Elyria. So there remains many unknowns that we're committed to holding university hospitals accountable for the answers to these questions. But the broader conversation we also discussed was in regards to how to interpret this decision. What does it signal? Much of the feedback we got from the community was that they were concerned that this was just a continuation of the signaling of the beginning of the end, that this is leading to the eventual loss of more services here in the city of Elyria and for our surrounding community. CEO Zinti and his successor, Dr. McGarrion, gave their commitment that this was not the case. And my challenge to UH is to prove that to be true and make a significant investment, a flagship investment in families and children's health care here in the city of Elyria for Lorain County. I issued this challenge to their team and offered our support as well as our accountability. And Mr. Zinti and his team seemed up for the challenge. So there's a twofold request here. First is to review the local data and the impact that this decision can have on our community, and weigh if the benefits will outweigh the detriments, and if not, to find an alternative to closing the birthing center. Secondly, is to signal to this community that University Hospitals is committed to family and children's health in Lorain County through making a significant flagship initiative investment that has been done in other communities to signal to Lorain County families that UH is here to support our community's health from before birth until death. We'll keep you all informed on the developments of these conversations on our website, cityofelyria.org, where you will also be able to find the results of that survey. And I'm going to pass the mic to Commissioner Koval, who was with me in that meeting today, and then we'll have some remarks from the others as well.
Good afternoon. I'm Dave Koval. I'm the Health Commissioner of Lorain County Public Health. And I want to just talk a little bit and echo the mayor's concerns. We had a meeting today with UH leadership, and you know, one of the big successes we have here in Lorain County is the incredible work we've done around infant mortality, especially African American infant mortality. We've really done some great stuff, and I'm really worried that moving the birthing center could have an adverse effect on it. And all of our work that we've been working on for so long could have a problem, and we may not have the results we're looking for. So they have reassured us that they want to invest in prenatal care and postnatal care, but again, there's a lot of work to do and a lot of planning to do prior to that day. And so I really look forward to working with UH down, as this goes through, to try to make sure that they can actually offer those services here in Lorain County. With that, I'll just turn it over back to the mayor.
Next, we'll have some remarks from Dr. Rima, who is the chair of the department at the OB department at the Elyria Medical Center.
Hello, my name is Dr. Rima. I am the chief of the OB department at Elyria. Thank you. Thank you for inviting me here. My biggest concern is, of course, the patient safety. We have a large high-risk population here in Elyria, and a lot of the issues that can occur are acute events that need to be handled in minutes. big problem. I used to work for EMH when it was EMH, starting in 2011 before I started my own practice in 2015. And I know several of our patients had to even walk to see us at the office. Some of them barely made it to the ER without delivering the baby in the elevator. So transportation is a big part of it, and I've overheard things such as shuttles or Uber or other different rides that patients can take. We all know that this is unrealistic, and a lot of these drivers, I bet, would be pretty scared to hear women in labor or possibly even bleeding or needing emergency care. The other issue we're worried about is them presenting to the emergency room with no OBGYN on staff at Elyria. Several of the emergency department physicians and nurses actually have voiced their concern there as well. Not to mention the fact that the nurses, the lactation consultants, worked very hard to get what we call a baby-friendly status, which is a big accomplishment on their end, and is one that we have for a few years. So we will end up losing that status that we worked so hard for. And of course, all of the different nurses that are going to also lose their jobs, 40 obstetric nurses that are told that they'll be placed in other positions that truly are not even available. So I do also work at St. John's. It's a good department. My big concern is more the fact that we do need more than one hospital here in Lorain County so that care can be given to everyone. Thank you.
Next, we'll have some remarks from Mayor Jack Bradley, City of Lorain.
So, Frank and I are new mayors to Lorain County. We both started off at the beginning of January, but since that time we've become very close, and if Mayor Whitfield calls me, I'm going to be there. And he's right. This decision not only affects the city of Elyria, but it affects all of Lorain County. And my concern is that citizens from the city of Lorain, newborns from the city of Lorain, could be affected by this decision. And you know, I have a little granddaughter, 6 years old. She was born at University Hospital, and I know that my daughter received very, very good care at University Hospital. I want that to continue for all the citizens of Lorain County. So we hope that University Hospital reconsiders this decision. We want not only the citizens of Elyria, but the citizens all over Lorain County to have the kind of care that they deserve in our communities. So I thank you very much.
And I saw there were some questions, so we'll go ahead and open it up for questions, and I'm sure some of you all will be called on for some of the answers, so feel free to go ahead.
So what is the next closest birthing center, or what does that do to the total birthing centers in this area then?
Yeah, so Dr. Raymond may want to speak to this, but the city of Lorain has a hospital that has a birthing center. It is a Catholic birthing center, which again, this process has educated me so much on. There's differences in birthing centers and what services are available, so it's been quite eye-opening that this is the last non-Catholic birthing center in the county of Lorain, so it's been quite eye-opening. Questions?
Is St. John also a Catholic birthing center?
Yes, it is. In fact, St. John's and Mercy are pretty much in the 20-mile radius from Elyria, and yes, patients have voiced concerns about getting tubal ligations, which cannot be performed at these Catholic hospitals.
Is Fairview the next one then?
Yeah, Fairview would be the next one east, but we don't really have any closer ones west. So, yeah.
In terms of this transportation issue, I think this can't get lost. That if you just look at it on its surface, you think, all right, in a traditional metropolitan area, 20 miles away isn't that big of a deal. But when you don't have public transportation, and that you also don't have that density. Like if you were to pull out your app right now and pull up Uber, it's probably going to take about 30 minutes right now for an Uber. We just don't have that sense of density here in Lorain County. So this is a huge transportation lift, and this is something that's been worked on for decades in this community, and people trying to improve transportation. And we just don't think in 3 months that we'll be able to figure it out that quick. So even delaying the decision is something I think would be important as well.
In your meeting with them, I mean, what reasons did they give for them to close it?
So the question was around what was the rationale behind it. I'd ask you to I'd tell you to ask them. But a part of it is this theory around volume, around there was a lack of volume. And how volume drives care, and it's really it was all about quality. How can we improve quality? How can we improve quality? And that's the challenge, is that all right, if we believe by bringing everyone to one location in Westlake will improve quality, do we just raise up a whole nother social determinant of health that may negatively impact and overwhelm and outweigh the benefit of the care that's there when people can't access it? So that's what we're trying to convince them. If this was a different community where we could just flip on the switch of transportation, I think I could understand that logic, but that's not the situation in Lorain County. So the question is around the cautious optimism, and the optimism comes from their willingness to sit down with, and I do appreciate CEO Zinti and his successor, Dr. McGarrian, for sitting down with us and having, and it was in good faith. It was good dialogue. I mean, they were listening. We were listening. It was a good dialogue. So I respect that. So I'm optimistic that they're willing to engage and have conversation. The cautiousness is that it definitely seems like this decision has been made and they're going to stick with it. And flipping back to the optimism, again, we said, well, how do you make sure that this isn't a pattern, that you're not signaling to this community that this is just a continuation, and eventually we'll be having another dialogue like this about more services being lost. And the optimism was they gave the verbal commitment that no, we're going to prove to you that University Hospital is committed to the city of Elyria. So now it's just about holding their feet to the fire, holding them accountable, and making sure it actually happens, and supporting them on the journey. We told them, Commissioner Kovo and I shared, they don't have to do this in a vacuum. We feel like this decision was kind of made without some of the dialogue from the local partners, that we may have been able to come up with another solution for them. And so we caution them on doing it in a vacuum and to work with us collaboratively to make this happen.
Are there any future talks planned, and have they committed to having an ongoing dialogue with the city?
Yeah, so since last Monday, we've already met 4 times. So and that was our first meeting with the leadership from Cleveland, but they definitely assured us that this was the first of many conversations. So I think we all walked away from the meeting, as I mentioned, cautiously optimistic. And I want to I tried to make sure that the voices of this community were heard. We have problems getting people to respond to census questionnaires, getting 100 of those. We had 900 responses in a week. I mean, this wasn't yes or no questions. These were full paragraphs about why this was important to the community. So this is an issue that, it's not just about the people around the table and their opinions and thoughts and theories. This is about the community and what they're feeling and what this means to them. So that's a part of what we have to make sure is at the forefront of our conversations. All right. Thank you all. Appreciate it.
Okay, everybody, that's it for now. Thank you very much for tuning in. We do have a reporter here, obviously, so he'll have more information tomorrow.